antibody tests, which are also testing people, but that's testing past infection. We have a unit here that's looking at wastewater, that is looking at if the virus, live virus, or fragments of the virus are found in wastewater. We do understand that there are fragments of virus. This is not live virus or infectious virus that can be found in wastewater. So it's possible that that might be something that could be used to look at where the virus may be, but it's important that we focus our attention on looking for the virus in people. Countries have demonstrated the ability to, if you aggressively look for cases, human cases, and find those individuals, isolate those individuals, care for them depending on the severity of their illness in a healthcare facility or at home if that can't be done, and identify all of their contacts and quarantine those contacts. We know that that works, and that can stop transmission.
If we could, maybe just emphasize that point. I think we've said this a couple of times. I mean, science and discovery is very important, and looking for the virus in different samples, have been able to find different ways to monitor the presence of the virus, be it in environmental samples, very important, in antibody tests in recovered patients, very important. They all have an importance, and they're all very important for understanding the long-term trajectory of the pandemic. But we seem also to be avoiding the uncomfortable reality that we need to get back to public health surveillance. We need to go back where we should have been months ago, finding cases, tracking cases, testing cases, isolating people who are tested positive, doing quarantine for contacts. We have seen time and time again in countries that have contained this virus and brought it under control without the need for massive lockdowns, have done it through the application of principled, human rights driven, but sometimes quite aggressive public health surveillance. And I think we sometimes, and I think this is something we do in society, we sometimes look for the answers where they're not. We need to go back to the basic principles of how we control this disease. A comprehensive strategy that matches basic public health surveillance, community education, knowledge and empowerment, with a strengthened healthcare capacity to treat cases, and we are able to pull those three things together and develop a vaccine in the medium to long term. That's the core. There's a lot of other information and science that needs to be discovered around that, but we need to stick to the core strategy, or else we really will risk looking for answers where the answers are not, or the answers to the questions we're asking are not going to solve the problem we have. We know the problem we have.
Thank you very much, Dr. Ryan and Dr. Van Kerkhove. Now we will go